when you talk to your medical director or you talk to anybody who controls purse strings or makes decisions about whole blood, what they will often do is fall back to a meta-analysis that demonstrates not much of a benefit with the administration of whole blood in the field. But Dr. Peel, the point that you're making is that we don't need an RCT to demonstrate the benefit of whole blood. In fact, it kind of all boils down to the parachute paradox. Tell me a little bit about that.
Right. So one of the pushbacks on pre-hospital transfusion of any blood product is we don't have enough data. And when you do look at the existing randomized controlled trials and assimilate them into one, there's not evidence that that therapy saves lives. And as I pointed out today, none of those trials are applicable to our environment where we're giving whole blood or component therapy in the field in 911 ground response agencies. And so the pushback I give is we never will have an RCT of this therapy. We have enough data from our agencies that are giving it and from other published data that are not mentioned in these systematic reviews to know, and really data back from as early as World War II, that whole blood given to patients with traumatic injury and hemorrhagic shock saves lives unequivocally. And so I gave the analogies that we have it's obvious to us that it works. We have a good evidence base, though not with randomized trials. Do we have equipoise? You have to have equipoise to have an RCT, which means we don't know which is better. A bleeding patient in the ED, when you bring them to the ED, is going to get blood. Why are we not doing it a few steps earlier?
Is it even ethical to have an RCT?
I don't think it's ethical to have one. And I think the pushback that we need one is an excuse for some other reason someone doesn't want to do it. I will say we do need trials of many things. We just had a discussion about empiric calcium, how much TXA, what type of blood product, whole blood versus red cells. There are randomized trials of component versus whole blood therapy in kids going on right now in the ED, not in pre-hospital. But there are many important questions to answer with randomized trials, but not whether or not we give blood at all to someone who's bleeding.
Whole blood is obviously the solution to somebody who's experienced hemorrhagic shock.
Right, because it contains all the components we need, the oxygen-carrying red cells, the clotting factors in the plasma, the platelets, which are clotting cells, and a variety of other things. We need all that mixed into one product. It works like magic when we see someone in severe hemorrhagic shock.
In fact, if you were to create a medication that you would give to somebody in hemorrhagic shock, it would contain everything that
it's
whole
already
blood
been
does.
made. It
Right.
just comes out of us, right?
Right.
So
Awesome. Thanks.